All right. Hi, everyone, and welcome. See you coming in. We're just getting started. Glad to have y'all on today. Thank you for joining. I'll be guiding us through our presenters and just some housekeeping this morning, afternoon, wherever you are. And looks like we've got a good few folks filling in. And so I'll just go ahead and kick it off. Thank you all so much for joining. We'll be right on time today, 45-minute webinar. And we're excited to talk to you today about turning new demographic standards into actionable insights. So this will be a presentation about talking about the changing standards on the national level, and then also how we can put that updated data into action using the HCI platform. So thank you so much for joining, and Ken, you can go to the next slide. All right, so please take a moment to pop your introduction in the chat if you can, and you can share your name, your role, and your organization if you'd like, and then optionally your location and LinkedIn profile if you want to connect. So I will pop my own information in so you can see I'm Elizabeth Bobo, also say it aloud. I'm a Senior Public Health Strategy Consultant here at Conduent HCI, and I'm in New Orleans, Louisiana, not raining right now for once, and be happy to connect. You can see my LinkedIn in the chat, and it looks like a lot of us are finding the chat so far. Thank you for popping your information in there. And we will be using the chat as we go. So Ken, you can go ahead to the next slide. Please keep sharing your information in there. We'd love to see who's here, see where we are across the country. And just so you're aware, the chat will also be where we will accept questions during the presentation. So please, if something comes up, type it in there. We'll keep track. Myself and a couple of my other colleagues are here keeping note of what's going on in there. And we will have Q&A time held at the end to address any questions that you might have. And then also just an FYI, we will have a recording made available of this presentation. If you are registered, you will get it via email, and it will also be available in our help center. So the link that you'll get in email will be there. If you had colleagues who couldn't attend today, feel free to share that with them as well. And continuing on, thank you, Ken, with the slides. So we are really excited to have you here with us today for this webinar on demographics data on the HCI platform, and then also in the context of larger OMB standards updates. So you can see here what we'll cover during today's session. So we'll start with a brief overview of the recent updates, the Office of Management and Budget. Ashley, I'll introduce her in a second. We'll go through those race and ethnicity standards changes and why those changes really matter for demographic analysis and reporting. And then thereafter, we will walk through the changes to the Quick Facts demographics page and Claritas demographics page to get a little bit more in depth with a live demonstration showing how to navigate the dashboards, find the data you need, and download outputs so you can use those demographics in action in reports and other places you might need to implement the data. We'll also see how you can use these demographic data on the platform with our tools like stories and tiles. We'll finalize out with Q&A as mentioned before, and next steps where you can find us, continue the conversation, and ask any questions thereafter if you need. And we hope to have you throughout and get some good questions for that Q&A section. So on to the next one. Thank you so much, Ken. So before we dive in, I'd like to share a little bit of background on Conduent Healthy Communities Institute, or HCI, as we call ourselves. So I know we have some folks that may be more or less familiar here. So everyone's aware, HCI provides end-to-end solutions that link health and social determinants of health data with technology and public health expertise. So with these tools, we support health departments, health systems, hospitals, and community collaboratives to make your community health improvement work more transparent, collaborative, and really data-driven. So as you can see on the right side of this slide, our team of multidisciplinary public health experts in partnership with you, our clients, have an impact on over 90 million lives across the country in over 31 US states and territories. We have over 18 years of experience making the most out of community health data through these strategic support services and also with our web-based software as a service, the HCI Platform. We also have completed over 500 community health assessments or needs assessments, CHAs, CHNAs, as you might know them, and implementation plans or implementation strategies, depending on if you're coming from a health department or a hospital. Our presenters today will be Ashley Went, Conduent HCI's director, you can see on the left, and Ken Bala, our senior business strategy and solutions architect. So now I'll pass it to Ashley to dive into the changes to those national data standards.
Thanks, Elizabeth. Just confirming that you guys can hear me, having a bit of computer trouble over here. But welcome, everyone. It's really great to see some names coming across as people are joining that I recognize, and a lot of new folks too. So welcome. Again, Ashley Went, Director of Conduit HCI. Excited to talk to you about some of these changes that Elizabeth introduced. So just to get us started, we all know our communities are changing and the data standards used to understand them are changing as well. And as organizations increasingly rely on demographic data to guide decisions, it's important for us to understand both the value of these data as well as the evolving standards that shape how they are collected and reported. So just to level our understanding and give a brief reminder of what demographics are. Demographics are defined as the statistical characteristics of a population, such as age, sex, race, ethnicity, income, education, employment, household composition, as well as geographic location. And this demographic data can help organizations understand who makes up a community and are commonly used for planning, resource allocation, policy development, program evaluation, and identifying disparities among the populations and communities where we work. So with new federal race and ethnicity standards on the horizon, it's important for us to understand what's changing and how to adapt while maintaining meaningful and reliable data. So today we'll be focusing on key populations and practical approaches for moving forward with confidence. So before we dive into the details, I think it's helpful for us to understand where these changes are really coming from. So the Office of Management and Budget, or OMB, is the federal agency who's responsible for establishing these standards that are used across the government for collecting and reporting demographic data, including race and ethnicity information. And in 2024, OMB released the most significant update to these standards in more than 25 years. The goal of these changes is to improve how demographic data reflect the identities and experiences of the people and communities we serve. So over the next few slides, we'll be highlighting 3 of these key changes. The first one here is the move to a combined race and ethnicity question. Rather than ethnicity and race being asked separately, the new approach is a single question that allows respondents to select all identities that apply to them. This change is intended to better reflect how people self-identify, improve data quality, and provide a more complete understanding of increasingly diverse communities. The second change is the addition of a new Middle Eastern and North African, or MENA, category. Under the previous federal standards, individuals with origins in countries such as Lebanon, Egypt, Iran, Syria, Morocco, and Iraq were generally classified within the white population category. And as a result, the unique demographic characteristics, health outcomes, and community needs of these populations were often difficult to identify in data analysis. So by recognizing MENA as its own category, this updated standard provides a more accurate representation of these communities and creates new opportunities to better understand disparities, tailor our programs and services, and better inform equitable planning and resource allocation. The third change is an increased emphasis on collecting more detailed subgroup data. So rather than relying on broad demographic categories, organizations are encouraged to capture more specific subgroup information when it's possible. This additional level of detail can reveal important differences in community needs, experiences, and outcomes that may be hidden when populations are viewed as a single group. While these updates may seem really technical, they do have important implications for community assessments, surveys, health equity analysis, trend reporting, and decision making. And understanding them now will help organizations prepare for future data collection and reporting while continuing to generate meaningful and actionable insights. And finally, I just want to reiterate why these changes matter. These changes are important really beyond updating data categories. They represent an opportunity to better understand our communities, improve our decision-making process, and advance health equity through more accurate and inclusive data. For better data quality, this improves the accuracy and completeness of demographic data by better reflecting how individuals identify themselves and reducing misclassification in the data. And how this impacts our work. This can impact surveys, community assessments, dashboards, reporting, trend analysis, and requires thoughtful planning to maintain data consistency over time. And then for more inclusive insights, these changes ideally provide a greater visibility into diverse populations and subgroups, helping organizations better understand community needs and identifying disparities. And finally, for organizations that are thinking about these changes early, those early adopters, this allows us to position ourselves for future reporting requirements, strengthen decision-making, and build more equitable data-driven strategies for serving our communities. And as far as timeline, the standards became effective as of March 2024. For these new federal data collection tools, and agencies are currently working to update systems over several years. And many major federal data sets, including the census, will transition between now and 2030. The Census Bureau has indicated that they will begin implementing these changes with major surveys in preparation for the 2030 census. And finally, although implementation of these standards will occur over the next several years, organizations don't need to wait to begin preparing. For those of us working in public health, community benefit, and on community health needs assessments, now is really the time to take a look at our survey instruments, our data collection processes, our reporting practices, and community engagement strategies to ensure they all align with these evolving standards. Our consulting team here at Conduit HCI has already begun incorporating many of these updates into our CHNA and CHA community surveys, working to help clients collect more inclusive, actionable, and future-ready demographic data while maintaining the ability to support meaningful trend analysis over time. So now that we've introduced these changes, I'd like to turn it over to Ken, who is going to discuss how these changes will impact our platform.
Thank you, Ashley. Hi, everyone. I'm just Ken. It's a Barbie joke, probably not relevant anymore. Ken was all the rage in 2023. Okay. Anyway, let's get back to the presentation. So today I want to show you how these standards turn into practical insights on the HCI platform and how your team can use this in everyday work. As we move into this product portion of the webinar, the key idea is that demographic standards are only valuable if they are easy to access, understand, and apply. So in the next few minutes, I will walk you through how demographic data shows up on the platform, how you can work with that data, and how these experiences support more informed decisions. I will focus on two parts of the platform, the Quick Facts, which is part of the standard package, and Claritas Demographics, which is available as an enhanced data package. I will also show how these data experiences connect to other tools on our platform so they can support not just exploration, but also day-to-day analysis and communication. So let us start with a quick view of where these experiences live on the platform. Okay, and I want to start with this quick visual. So on the left, is Quick Facts, which is part of the standard package and uses the standard dashboard experience that many people on this call are already familiar with. On the right is the Claritas demographics dashboard. This is part of an enhanced data package, and on the platform, it actually has its own dedicated module. You can already see that Claritas offers a more expanded visual experience. There's like a little pie chart on the screen you can see. No pie charts on the left. People love pie charts. Yeah, and so there's additional charts and data views available to all the users. Claritas also has different tiers. There's 100, 250, and 500 indicators available, depending on the package selected. For now, I want to use this slide to frame the two experiences and show how the platform supports different levels of demographic analysis, depending on a user's needs. And first, I'm going to start on the Claritas and focus on that. And then we'll go into the quick facts later. So why does Claritas add so much value? Well, at a high level, it gives users a much richer demographic picture of their communities directly within the HCI platform. Compared with the more basic experience, Claritas provides deeper detail across a wide range of characteristics, including population, households, marital status, income, education, etc. It also provides annual estimates for the current year, which gives users a more current view of their communities for planning and analysis. Another important advantage is geographic flexibility. Claritas data can be available at the state, the county, zip code, census place, or census tract level, depending on the package. It's very customizable. And because it is offered in tiers of 100, 250, or 500 indicators, users can align the level of detail to their needs. So the value here is not just that there is more data, it is that users can work with a broader, more current, and more practical set of demographic insights that support strategy, communication, and decision-making in your everyday work. With that in mind, let me show one of the most important updates in this experience, which is the redesigned module. And this view is just the PowerPoint still, but I'll eventually get into the live site. So with the updates, the race and ethnicity data have now been merged into a single unified race ethnicity page, replacing separate race and ethnicity pages that were used before. This is an important improvement because it aligns the platform with the updated federal race and ethnicity data standards, as explained by Ashley earlier. It also supports more consistent interpretation and a more accurate representation of how people self-identify. From a user experience standpoint, this creates a clear and more intuitive way to explore the data. Instead of moving between separate pages back and forth, waiting for pages to load, users now have a more unified view of this information in one place, which makes it much easier to navigate and easier to understand. In addition to these race ethnicity changes, the other 2026 improvements include updates to like indicator ordering, text and short title updates, a lot of little things, including integration into like the general search feature too, which is awesome. Altogether, these updates make the Claritas module feel more cohesive, easier to use, and better aligned with evolving public health and census reporting practices. Finally, Claritas data is not limited to this dedicated module. It can also be used in other parts of the platform. So, Claritas data can be selected in stories and in tiles. Stories and tiles are two website building features on the platform. Tiles are used to create web pages, and stories can be used to create cohesive reports. That makes the Claritas package more than just a place to view demographic data. It also becomes a resource that can support storytelling, analysis, and presentation and other tools that you already use. With this overview in mind, let me move into a live demo of the Claritas module on the HCI platform so you can see how it works in practice. It'll be easier to understand than what I was just talking about. And after that, I'll come back and show the quick facts experience and also it on the platform. So I'm going to share my screen to a live site, so hopefully there's no technical hiccups. I do like how Teams now allows you to like present directly in Teams, but I don't like how transitioning between Teams and the sharing my screen is not ideal. Maybe Microsoft will update that in the future. Okay, so now that I'm done complaining about Microsoft, okay, I'm currently on a demo site's homepage. This is not a actual site of any of our clients. One of the first things I want to point out is the demographics tile. So I just mentioned that tiles are building blocks for web pages on the HCI platform. And you can see that we have different building blocks. And what I mean by that is we have this search tile in the beginning. So it says Maryland Connects, and people can come here and search. And as I scroll down, we have one that says Quick Facts Indicators. This is called an indicator spotlight tile. We have an indicator map tile focused on the state of Maryland. And then further down, we get this demographics tile. So this is available to clients who have the enhanced Claritas data package, and it's very customizable depending on what a site wants to feature. For example, I created a pie chart called Race Ethnicity in Maryland, which gives a quick snapshot of the state level data right from the homepage. Just a note, the site has all the demographic data for Maryland. Did I say that? Okay. Yeah, so this is just the interactive pie chart, and it doesn't actually need to have all this information. So I have a lot of information here. However, if I wanted to make a pie chart, which technically wouldn't make any sense, that only showed like American, Indian, Alaska Native population, the Asian population, I could, but the pie chart would confuse people because it would not add up to 100. But it's what I'm trying to say, it's very customizable. Yeah, you can have it do whatever you want. Okay, so let me move into the Claritas module. So I have it up here, Claritas Demographics. And this is the 2026 Claritas Demographic Summary Data page for Maryland. This page brings together a range of demographic information in one place, including visuals for population, race and ethnicity, age, sex, income, etc. They're here as tabs at the top of the page, so it says summary, and that's the one we're on, but population, race, ethnicity, age, sex, etc. So a lot of different pages to navigate. Yeah. And if I scroll down the summary page, it shows highlights for each of those topics. So I want to point out this population by race ethnicity chart. This is the same general view I just showed earlier on the homepage. But here in the module, users have access to more detail, including supporting data presented in a table. So we have not only just the pie chart here, we also have all of our groups. We have the count, and we have the rate data all at once. And then one of the strengths of this module is that users can move from like this broad statewide view to a more local view and see comparisons. So we're looking at Maryland. Let me change this to a county, and I'm going to choose Prince George's County in Maryland, and the page will update. And now you might not notice it right away, but it says County Prince George's here, and then it says State Maryland here. So it is comparing between the two. And when I go to the table, I can then see information on Prince George's County in these columns and the state of Maryland in these columns. So that's excellent stuff. And if you go even deeper, for instance, to a census tract, if you have census tract data, it would show census tract, the county for which that census is within, so the county, and then also the state all together. Next, I'm going to move into the new race ethnicity tab. So this is one of the major updates. Instead of having separate race and ethnicity pages, there used to be two pages up here, two different buttons. The information is now brought together into a single page. And as I scroll down, you can see that that first one is population by race ethnicity, still all the way at the top. And then I wanted to show a few other details that are on this page. So now that we've passed that, we can see the more detailed information like population by race, ethnicity alone or in combination, ethnicity details, Hispanic Latino population by race. And this is a tier 3 site, so it has 500 indicators, the full set of indicators available. It has tons of details such as the Hispanic population by specific origin and the Asian population by specific origin. There's 500 indicators, so you can really dive deeply into the demographics in your community. Another thing I wanted to show is all of these charts have 3-line hamburger buttons. If you click that, you can then download this as like an image file or a PDF, and you can use it in your presentations, reports, or other materials. And not just you, anyone on your platforms can do this too. Let me click into an individual indicator. Okay, this one is the Asian Indian population by specific origin. And this is specifically in Prince George's County. So this is going to load County Prince George's. So we have the population of Asian Indian people. And when I get to this individual indicator page, there's tons of information you can find. So we have two bar charts here, one comparing to all of the other indicators within this category. We have a comparison to all of the counties because we're looking at the county level. We have a map here that people can navigate and see the data by map. And there's a table too. So this is especially useful when someone wants to look more closely at specific demographic measures and interact with it at more local levels. And this is also another place where export options are available. So as long as you see these little buttons, you can come here and you can download the charts or the maps, and that is great stuff. Okay. We're almost done with the Claritas part, but before I wrap up, I wanted to show one more thing. So when I first started this, I showed that tile on the homepage, and I said that tiles are building blocks, and you can put that on any single web page on the site. But we also have the tool called Stories, which I had mentioned in the PowerPoint. And here's an example of a story that uses Claritas data. So in this story, I want to show a few different ways the Claritas indicators can be used. So here, at first, we have a bar chart. And this is quite interesting. It shows the Black African American female population by age group for selected census tracts in Prince George's County. So this breakdown shows the race, sex, and age all in one chart. The standard demographics can't go into this level of detail. So if I was looking at 24033800102, that census tract, and then I wanted to know what the Black African American female population was for people over the age of 65, I can see that it's 18.39%. So it's interesting information. And this is fully customizable. I chose these specific census tracts and these specific groups to highlight there. As I scroll down the page, we have our bivariate maps. This one is a little bit different because it shows both Claritas and a standard indicator. So this shows educational attainment, specifically the population age 25 plus with less than a high school degree, overlaid on a map of adults who binge drink in Maryland's counties. So the education information, that is from Claritas, and the binge drinking, that is a standard indicator. So this is all the counties in Maryland. And when we zoom in, we get all our colors, and there's one county right here, Baltimore City, that is in the worst group. So I can click on that. It'll focus. We can see that it's this group. It's has the highest rates of binge drinking, and it has the worst rates of high school graduation. So yeah, you can overlay the data on top of each other. It's good stuff, and it works with all of the other data too on these tools. And finally, there's just a little picture here for those that have the Claritas demographics. If you're not using them in your stories, all you need to do is when you create a new content item, there's a little tab that says demographic. You just click that button and all of the Claritas demographic data pops up, and you can then select it as your indicator. So a lot of good stuff here. I'm going to return this to the homepage, and now's the big moment when I click the Present in Teams button again, and it goes seamlessly back to where we were before. So let's see how this works. Oh, we're waiting. It's coming. Okay, I see it on my screen. So I think that means everyone can see it.
Got it.
And it should say Claritas live demonstration. Perfect, we did it. Whew. Okay, we're back. So that was the Claritas demographics. And now we're going to move over to the QuickFacts demographics. QuickFacts uses the platform's standard dashboards and standard indicator pages rather than going into that separate module I had just shown. Users can work with this demographic information as they would any indicator on the platform. That makes it a practical option for those who want demographic insight built directly into the standard experience. For example, on screen, you can see that the dashboard layout appears the same as any other dashboard, and I'll show one of those in a few minutes. But you may be familiar with like the Healthy People 2030 dashboard. It's the same layout, which the indicators stacked on top of each other. One of the most important updates to QuickFacts this year is expanded location coverage for selected demographics. So historically, QuickFacts provides data at broad geographic levels, such as state and county. And what we did with the platform is we actually have selected indicators that can now be available at sub-county levels, including census tracts, census place, and zip codes. So just a note, these indicators are like the same in title, but they may be using different data sources for these additional geographies. So the county, which is part of the QuickFacts, may use the US Census Bureau as its standard source, but a census tract for the same indicator may use the American Community Survey, like 5-year survey. So there are different sources, but it's still the same indicator. And having these additional geographies gives you more flexibility to explore demographic patterns at a more local level, which is great for everyone. And I'm gonna switch back. Okay, let's try this one more time. So it should be swapping. Oh, there it is. Okay, that'll load in just a second for everyone else. Okay, you should all see it here. So I'm going to show the QuickFacts experience, and I'm on that same site, same homepage. And I had mentioned tiles earlier. I said this is a search tile, and I showed the demographics tile. And these two in between, these are standard tiles. So this first tile is called QuickFacts Indicators. It shows 3 indicators, and they're selected comparisons. It shows the total employment, it shows the population Black or African American, and it shows the mean travel time to work. This is a standard tile available to all clients. It is called the Indicator Spotlight tile, and you can choose up to 4 indicators to spotlight at once. You can just show 1 if you want. And I specifically chose the QuickFacts indicators, and they just appear like this, which is great. The next tile, let me scroll down so it's centered, is the Indicator Map tile. And this shows the population age 65 and over. This map is at the county level. I can zoom in a little. Okay. And so yeah, you can create maps with all of your indicators. If I select this indicator, I can do that by clicking Learn More or by clicking the title itself. So we're going to do a little bit of a dive into this population age 65 and over indicator. And this particular indicator, I just want to say, is one of the standard indicators. Well, it's one of the standard QuickFacts indicators, but it's also one of the expanded indicators. For example, I can select even more granular locales with this one. So as I scroll down the page, we can still see all the data for Baltimore City. It's the county we're focused on. And we have our map and we have our bar chart and our table. But if I want, I can use the location selector at the bottom of the page to select a zip code. So let's do that, 20601. And what's going to happen is the page is going to reload for this specific zip code, which is great stuff. And I can scroll down this page and you're able to see that there's fewer historical data points, but more are coming, which is good, just because we only recently expanded this now. We can also compare to the county level if we want. And we have our map showing all of the zip codes now instead of all of the counties. So this is good stuff. And I want to also show the QuickFacts demographics dashboard. So I will select that. And I kept mentioning that this is like a standard dashboard and what those look like and how the indicators stack on top of each other. So this dashboard will load in that normal format. The default location is generally the highest level, but you can customize that. This is Maryland. It's the highest level for this particular platform. And you can use this dropdown to choose more granular levels if you want, which is good. First, I'll scroll through and you can see all the QuickFacts indicators like total population. We just looked at that population age 65 and over. We have our population Hispanic or Latino, and there are lots of indicators here to choose from. As this is a standard QuickFacts geography, there's all of the possible indicators. But let me now choose a census tract because I like census tracts more than zip codes because I'm anti-post service. I'm just kidding. I just like that we have a lot of census tract data, and everyone knows zip codes are just mailboxes. Okay, so we just loaded a census tract, and you can see we still have a lot of indicators. We don't have all of the indicators available at this level because the American Community Survey and other sources don't quite have all of it yet. But we have our population age 65 and over. We have all of our race and ethnicity groups, and we have other information too, like median housing unit value for that census tract, or average household size, or computer and internet use. So there's now a lot of information for census tracts too, which is great. And yeah, the last thing I want to do is go back to that story from the beginning. Okay, so this is that story I had loaded in the previous demonstration for Claritas. I want to mention this bar chart again. So remember, this bar chart here is using Claritas data, and it's focused on the Black African American female population by age group for certain census tracts. Please get this burned into your memories because we're going to change the page and it'll be a different bar chart. And I just want you to remember how this appears. So we're looking at the Black African American female population. We have 4 different age groups for selected census tracts, and I'll change the page. And what's going to happen is we have a new chart, and this bar chart uses QuickFacts data. So this bar chart is not the same. It is the Black African American population across all counties in the entire state. And it's just all counties. It's not separated by sex or age like the other chart. However, QuickFacts offers a clear county level view of the population, making it easy to explore. You can see the key demographic patterns very simply, which is great. But if you want that more detailed local level analysis showing race, age, gender, all in one chart, that's where the Claritas comes in. So they both have different pros and cons. And let me switch back to the PowerPoint so we can finish this up. Okay, present in Teams, final time. See if it works. Drum roll. I don't know if you could hear my drum roll. Probably not. Okay, and that should be loading again. And back to the PowerPoint. Okay, cool. So as we wrap up this final section, I want to leave you with a few key takeaways. First, QuickFacts continues to support the standard experience and now includes more geographies for more local insight. That means users can stay within that familiar dashboard and the indicator pages while accessing more detailed place-based data. Second, Claritas provides a deeper demographic layer, including a unifying race and ethnicity experience across tiers and visualizations, and these are aligned to updated federal standards. This makes the data easier to interpret and more consistent across the platform. And finally, both QuickFacts and Claritas support practical, actionable analysis. They integrate with the platform's tools, like the dashboards and stories, and Claritas in particular offers more powerful options for deeper exploration and communication. So taken together, these experiences give you flexible ways to explore, apply, and act on demographic data depending on your needs. And with that, I'm going to pass this back to Elizabeth, who has been collecting questions.
Thanks so much, Ken. This is great to see the things in action and how those changes have been implemented. So now is your time to speak. If you have had questions, Risha, thanks for sharing yours, asking about the Claritas demographics in action. We answered that. I answered that in the chat, but if y'all have any similar questions or would like to see examples, please let us know. But I do have some questions that we've pulled together prior. Okay, just kidding. Colleen got one good in the chat. So Ken and or Gaussman team, do the geographies you'll be providing into our Claritas demographics products, i.e. are all levels, the tier 1, 2, 3, getting tracts levels in addition to the current zip codes, county. Okay, so that's a caveat, Ken, with what locales are available.
Sorry, I
answer
did
that.
not. I didn't understand your question. You said
Yeah,
et cetera a few times.
I'll go ahead. I know the answer.
Okay.
um, so Colleen, all of these
Oh, okay.
geographies are available. So census tracts or zip codes, most platforms will have county and one or the other. There is an additional licensing fee if you would like to have both. So that's probably where the confusion lies. There's opportunity to have all of them, but the the general level is one or the other for the sub-county locales. Does that answer
Yeah,
that?
yeah. So yeah, definitely. All of the geographies are available. It's just up to you to select those geographies when we set it up on your platform. But if you ever want to change, feel free to reach out to your account manager, or if you're not a client, you can always just reach out to Elizabeth or someone else on the call. There's an email at the end, communityhealth@conduent.com. It goes to Elizabeth. And she'll be able to provide you with answers. But
Absolutely.
yeah, you can pick and choose which levels you want. So you can have like state, county, census tract. You could have state, county, zip code. You could have state, county, census tract, and zip code.
Exactly. Lots of options. Yeah, so Colleen, if you wanted to switch them out, we could do that, or we could add on if you'd like all or different specific ones for you over there on the East Coast. Anybody else, feel free to pop questions in the chat, or I will take on some that we've gathered. All right, so our team, with clients in mind, from y'all's perspective, we've pulled together some questions. So thinking about, when do you expect the MENA or the Middle East, North Africa data to be available?
Ooh, okay. So I saw the next like ACS release might have it. They're gonna have like their first 2025 like data release in July, focused on like geographies. But that's not like the actual like 5-year survey yet. That'll be in December. So in December, hopefully it appears. If the government was more forthcoming with this information, that'd be great. But it will definitely be available in 2030 for the next census. And I say
Excellent.
definitely because, you know, that's what the government said they'd do. Yeah.
It's what is expected, but some of these communications are harder to track down these
Yeah.
days.
So
Yeah,
2020 or 2030 at the latest.
for sure.
That seems
Yeah.
far away, but it's not that far. Yeah.
So this is great to think about too if you're collecting, say, community health assessment data, demographic data locally. This is when you can have that bigger picture in mind of comparing to nationally collected data as well. And Colleen, I see a follow-up. So would you be able to provide our site breakdown? Okay, Colleen, we'll follow up with you directly. That one's a little less general to the population. If anyone has general ones, though, I'll keep that one, Colleen, to the side. But if y'all have general questions, please pop them in the chat. We'll come to them. But so kind of related to what I just mentioned, Ken, do you have any thoughts about how clients can utilize or implement the changes we've mentioned in their own primary data collection? And why is that
Ooh,
important?
yeah. So if you're using the platform to upload your own data, which I highly recommend you do, you can upload as many indicators as you want. You can also upload breakout data, and all the breakout codes are there for the new groups like MENA. So you could just add that normally, like you would add your other data, and it would visualize on the page. So if you're collecting data, please do that. And if you're collecting data like for like CHNAs or CHAs for your reporting and your surveys, I recommend you start updating your like demographics questions to include these new groups and follow the OMB guidelines if that's what you're interested in. And it would definitely make things more clear to your constituents.
Exactly. We want to be as representative of people as we can be. And with this in the time in mind, I will continue us on. Last call for questions in the chat. Otherwise, we're going to scoot it along. But one note before that, too, based on Ken speaking on updating your own surveys, we also on our end have consulting services where we can conduct and provide those surveys for you. So we are updating these kinds of questions on our end as well. So reach out if you have questions or want to talk more about what that can look like. But for the sake of time, let's continue on. And Thank you all so much for joining us virtually today. We hope you've enjoyed this presentation and learned something that you can take back to your team. But before we close out, I want to share our contact information, as Ken mentioned, and an upcoming opportunity to connect. So my colleagues Bianca Villalpando, Jason Beckstead, and I will be attending FICON and Nature 360 in person in Louisville, Kentucky in a couple weeks, so from July 13th to the 17th. So please stop by booth 216 in the exhibit hall to say hi. We also have a couple of virtual presentations that were accepted to the conference, which if you're on our email list, you will hear about all of this again soon. So if you don't catch it immediately right now. But we have a presentation that I did with Franklin County Public Health in Ohio on leveraging real-time overdose mortality data to drive community action and transparency. And then Bianca presented with Klamath County, Oregon, on building a culture of health focused on community-driven approaches to health equity in Klamath County, Oregon. So look out for the recordings of those to be shared via email and on our Help Center website and LinkedIn after the conference concludes. And then if you join today to learn more, but your organization does not yet have an HCI platform, we'd be happy to chat about how our tools and support can enable more transparent, data-driven decision-making in your community. The HCI platform really brings together that data and these tools to explore, visualize, and communicate your community's health and well-being priorities. So as mentioned, you can reach us at communityhealth@conduent.com to learn more. And then if you're already working with an HCI platform but have more questions about Claritas demographics data, which offers that more granular and more timely insight, you can reach out to your account manager to learn more about the different tiers that Ken mentioned in his presentation. And lastly, next steps. We can continue on to the next slide, please. I will share in the chat. Please take a brief moment to complete our feedback survey. That link shows up kind of dark, but hopefully y'all can see it. We would love to hear what you've thought about today's presentation, and please fill that out. And as a reminder, we'll share the recording with you via email and in our Help Center, so look out for that email follow-up. And if this concludes our webinar today on turning new demographic standards into actionable insights. So thanks again so much for your time and have a great rest of your day.
Thanks, everyone.